The heart is an amazing muscle. About the size of your fist, it will beat more than 2.5 billion times during an average 66-year lifespan. But sometimes the rhythm of the heart goes awry, causing a-fib, or atrial fibrillation. Dr. Eric Johnson of the Stern Cardiovascular Foundation joins us on today's Heart of the Matter to explain. And Dr. Johnson, thank you for joining us today on Heart of the Matter. So what is atrial fibrillation?
Atrial fibrillation is a very common heart rhythm. It causes an irregular heartbeat. Just like your house, your heart has an electrical system. Normally you have a pacemaker site in your heart that causes a normal heartbeat. So the electrical signal spreads in a straight fashion through the top part of the heart and tells the top part of the heart to contract to push blood down to the bottom part of the heart. That sends the electrical signal down to the bottom part of the heart, and that's what causes a heartbeat. When you're in atrial fibrillation, instead of having a nice organized electrical signal, you have multiple electrical signals going crazy, multiple short circuits. So the top part of the heart is beating so fast it's just up there quivering, it's not really beating at all. That causes a rapid and irregular heartbeat. That can cause people to have palpitations. They may feel that pounding in their chest. They may feel their heart race. They may feel dizzy, lightheaded, tired. They may notice that their exercise capacity is decreased. If it's fast enough, it can cause people to black out altogether.
What are the risks of having atrial fibrillation?
The main risks of atrial fibrillation are the risk of a blood clot that can form and cause a stroke, and the risk of a weakening heart muscle that can lead to congestive heart failure.
Tell us about the treatment options for a-fib.
Traditionally, the most important things are to make sure the heart rate is controlled to help reduce the risk of developing congestive heart failure, and to make sure the blood is adequately thinned out to reduce the risk of stroke. In the past, we've used a drug called warfarin. However, warfarin is very difficult for some patients because it requires multiple lab draws over time, and patients have to be careful about their diet that they're on. There are a new class of blood thinners coming out that are an alternative to warfarin. With these newer drugs, you don't have to have your blood checked and you don't have to watch what your diet is.
Are there any new medications that are being used to treat the problem?
There's a new heart rhythm medicine out called dronedarone that's available. It's the latest heart rhythm medicine we've got, but there's some cautions for patients. So if you have a history of heart failure, you need to ask your doctor about this, or if you're in permanent atrial fibrillation, you're not a candidate for it as well.
What is available as far as new therapies for the treatment of atrial fibrillation?
That's really the exciting area for atrial fibrillation. So there's an alternative to medical therapy, and it's called a catheter ablation procedure. So it's very similar to a heart catheterization. So for example, when somebody has a heart attack, they go in the groin area with the catheter, and under x-ray they go up and inject x-ray dye looking for blockage. Well, we can do a procedure now where we go up with catheters inside the heart, and we find where the electrical signals are coming from that cause the atrial fibrillation. So with catheters, we can go up and we can ablate or burn those areas. Traditionally, what we've done is gone up with a catheter and burned point by point by point around these structures called the pulmonary veins to do a pulmonary vein isolation. So your pulmonary veins are where blood, after it's gone into the lungs to get oxygen, returns to the left side of the heart. We've got two new things that we're doing with atrial fibrillation and the catheter ablation procedure. One is we have this system called the stereotaxis magnetic navigation system, where we can actually do the ablation procedure remotely, which helps improve the success of the procedure. The newest thing that is only available at Baptist Hospital is cryoablation. So we now have a cryo balloon catheter available. So instead of going up and burning point by point by point, we're able to go up with a catheter that has a balloon on the end of it. We blow the balloon up and it freezes a vein all at one time to isolate the vein. And we think that's going to be better.
Dr. Eric Johnson, thank you for joining us on today's Heart of the Matter here on Smart Medicine.
Great. Thanks, Joe.